You see, COVID is a way of life now. Everybody, last time people learned how to take precautions. People were more afraid last time, fear of the unknown. Then they have realized that it is nothing, when you have to take precautions, and it is only through lack of precautions that we get COVID. So this time that panic is not there, and people are taking.
After COVID duty, how many days they are allowed to isolate?
No, we are giving them, say, 7 days. After that, there is no off. They just work in a non-COVID area.
And any of the health workers have tested positive for COVID? Any of you health?
We have had a health worker, but they have usually tested from outside. Contracted from outside. And we have had one patient who was operated, and then from the attendant who picked it up from outside, they developed a COVID. So patients directly related to work, we have not yet, I think, seen. Maybe in pediatrics, the senior resident, we have yet to understand.
More health workers like nurses and all come forward to volunteer, or are we like?
No, there are so many nurses who have come forward. There are many lab technicians who have come forward. We are appointing them. We have many health workers also who have turned out to be positive in their fight against this COVID. That means providing care to the patient. In the meantime, we have lots of nurses coming in to help out.
Do we have an number? How many of the health workers have tested positive?
Yeah, we have got. I can't tell you offhand right now, but quite a lot of them have come out to be positive. Including doctors? Yeah, doctors, nurses, lab technicians.
Any of your health workers have tested positive for COVID-19?
Yes, we have 2 doctors tested positive. One he has became negative. He's gone back home. We have one doctor, he's still positive, detected day before yesterday. And then we have 3 nurses, 1 sister in charge, and 1 of the sanitary staff.
So normally when the when the doctors and these medical staff test positive, does it create a lack of manpower or?
Yeah, naturally. Now 2 of our doctors who are COVID warriors, both of them are working in COVID, so it will create some shortness in the doctors, shortage of doctors. But these nurses actually, they were not. Some of them, I think 1 or 2 of them were not working in COVID. They from non-COVID ward. So probably it might have been contact with the patient party or someone, or from maybe outside. And so there will be shortage of the staff. But the higher authority, whenever such things happen, we always inform the higher authority and they replace.
Okay. What is the total strength of manpower out here, like the health workers? How many are working? How many COVID warriors, if you can say?
Exactly, you cannot say there. We have around 70 nurses, then around 40 the sanitary staff. Doctors, so several doctors only. We have only 3 who came for COVID duty. Others, we have our own doctors, nearly 50 of them. But some aged doctors, we are not putting them on COVID duty. They are doing non-COVID duties. Only like young ones are being sent for COVID duties.
Now, normally, what's the arrangement for the health workers? Like, normally after their duty, do they go home, or are they being quarantined here, or how is it?
Normally, those staff who have, who can be isolated at home, having their own rooms, we give them a freedom. One is they can stay at home, provided they have their own rooms, if possible, at least a separate toilet. Okay, and if they can think that they are safe at home, they can stay at home. If not, then the higher authority arrange for their stay.
So that means these doctors and nurses who have tested positive, definitely they've contracted the virus while taking care of the COVID patient, or is it
unlikely?
outside?
Because those who work in the COVID site, usually they wear full PPE. Very few of them gets positive unless they breach the PPE. But what we get are some of those who are working the normal site. So that is what I used to be very strict with eating together. The worst thing is when they eat together on duty, sit together, eat together, or they might have gone out buying something. And again, patient parties, they go out buy something. We are trying to restrict one patient, one attendant. But still then, public don't understand. Sometimes they go.
Don't forget to like, share and subscribe to East Mojo. For any queries, put them down in the comments section below and press on the bell icon for notifications.